Forgot to record. A few housekeeping announcements before we oh, sorry. Thank you for joining us tonight for perinatal mood support and lactation. This program is being offered in partnership with Breastfeed Durham. Other allied and public health related courses can be found on Piedmont AHEC's visual course catalog at piedmontahec.org. And now a few housekeeping announcements before we
When
begin.
you go back home,
By attending today, you are
don't
granting
go through
permission for,
Churton Grove because the Wi-Fi's bad.
sorry, if everybody can
Girl.
just mute
Oh, okay.
themselves. Um, thank you. By attending today, you are granting permission for us to record audio and video, which we keep on file for the purpose of verifying attendance only. Information regarding your attendance may be shared with various accrediting bodies if such information is requested. Please type your first and last name into the chat box so that we can verify your attendance. And please also rename yourself in Zoom to reflect your first and last name and your occupation or organization. No faculty or planning committee members disclose any financial relationships with ineligible companies, nor did this program receive commercial support, educational grants, or in-kind support. Within 24 hours after the conclusion of today's program, you will receive an email with instructions on completing the course evaluation. After completing the evaluation, you can request access to your certificate of completion through your MyAHEC accounts. If you have questions about attendance, evaluations, or certificates of completion, please do not hesitate to get in contact with me. My email is amber.wilkins@conehealth.com. And now a few words about our presenters. Bernadette Green is a devoted mother of five and grandmother of three. With a rich career as an early childhood educator, parent advocate, certified lactation educator, and community health worker, Bernadette has dedicated her life to nurturing and empowering others. Bernadette's background is in early childhood education, and as a licensed minister, she's deeply involved in her church and community outreach programs. As the executive director of Breastfeed Durham, Bernadette actively participates in community events where she shares invaluable resources and knowledge on chest and breastfeeding and other vital health topics. Her commitment extends beyond professional duties. She's renowned locally as the resource lady for her extensive support and guidance to parents in Durham. Bernadette's journey includes overcoming the challenges of being a teen mom, an experience that has fueled her passion for advocacy and support. She leverages this personal history to connect with and uplift her community, offering a blend of empathy, practical advice, and resourceful solutions. She also serves on the board of Fatherhood Durham, further cementing her role as a pillar in her community. Kimberly D. Harper is a registered nurse specializing in maternal health with a focus on leadership, implementation, and interprofessional collaboration. Currently, she holds several positions at the Collaborative for Maternal and Infant Health at the University of North Carolina at Chapel Hill, where she coordinates the perinatal neonatal outreach program project and serves as the co-PI on the Building Equitable Linkages with Interprofessional Education Valuing Everyone Believe project, which aims to transform perinatal health services to ensure that mothers and birthing persons are seen, heard, and valued. Ms. Harper is a key member of the Fourth Trimester Project, connecting new mothers and birthing parents with healthcare providers and community leaders to address unmet postpartum health needs. Her work emphasizes person-centered care and community-led change. And now I'll turn it over to you, Kimberly.
Thank you. I'm excited to be here and have this conversation with you all today. I'm going to share my screen. All right. I can't tell if we can see everything, but joined here today with Bernadette, and we're going to have a conversation about perinatal mental support and lactation. We want to first start with a icebreaker or to warm up the chat. And so if you could drop in the chat your favorite winter break, your winter drink, and things that brings you joy during this time. Hot chocolate. Awesome. Cool. I see lots of eggnog and hot chocolate and Russian tea, all warm things that help us. I hope you're able to have your warm drink while you're here together today and also enjoying our conversation. Bernadette and I are going to start with some conversations and we'll also interject. We wanted to have this more as a conversation tonight and also provide content. So I'm going to first share about the fourth trimester as a project that's based at the North Carolina UNC Chapel Hill School of Medicine. And our work represents a collaborative of diverse professional community leaders and new parents and community engagement and co-designed our work together. The way that we are focusing on changing and how we is looking about how we listen to patients and their teams and integrating patient voices to make a change and to change how we structure and engage with individuals. When we think about maternal mortality and the timing, a lot of it happens, about two-thirds of it happens actually during the postpartum period. And a lot of those deaths could be potentially preventable. And then when we think about the actual stages connected to those postpartum deaths, there's also thinking about mental health, and those that timeline also overlaps and overlines. And as we think about the research with that area, one of the biggest pieces is understanding the mental health contributions and how we can the support that's needed, and also supporting as we navigate this process in time. Often we think about how we provide care, it's very segmented, and when it really should look more like this, where everything is coming together in all areas, thinking about mood and emotional well-being, infant care and feeding, and how do we make sure all these pieces come together where we have both support as we navigate all the different transitions and things that happen during this time period, especially thinking about those early stages when we transition home after giving birth and how do we understand the sleep and fatigue and the contraception, all those conversations and all the things that happen during this time period? How do we design the care that's provided to mothers and birthing people as they make this transition? And one of the pieces is thinking about how do we change and transform that fourth trimester to support individuals as they go through this process, and what does it really mean when we think about those checkups, those check-ins? How do we provide the adequate support, especially when we think about the postpartum period, the body changes, and mental health and lactation as we support both of those. Um, I wanted to start with these are my conflicts of interest, my two kiddos on the side, and my family. And we think about um, that transition from having children, the pregnancy, you get ready, you're prepared, and you think of all the pieces that happen. Um, and often you often see the smiles and you see all the happiness and everything behind that, but you don't always see the things that people navigate and transition. We talk about baby blues, we talk about the pieces that may not actually be present, but often we don't see the what's happening beside behind the raindrops. And I think for me personally, navigating the process between being a healthcare professional, being someone that's supporting others as they deliver, and as home visitors, I thought that I had all the tools that I needed to be able to transition, but there was also that time frame of thinking about lactation and postpartum support and how I was going to navigate having postpartum anxiety. And so today we're going to talk about perinatal and anxiety, mood disorders, and thinking about how we can provide support with lactation. I'm going to start first with a snippet of thinking about what actually happens in that postpartum period initially and why do these things happen. So this is a snippet from our hormones and what actually contributes to our what no one tells you about postpartum.
Hi, I'm Allison Stubbe. I'm a maternal fetal medicine doctor at UNC. Let's talk about postpartum hormones. I wanted to share a little bit about why moms feel so cranky and irritable that 2 to 3 days after birth. Turns out it's because of a hormone called progesterone. So, with our periods, our progesterone levels go up and down, and that's part of why we feel a little cranky right before we get our periods. But that change with your cycles is like 0 to 10. During pregnancy, progesterone levels go up to 150. And in your brain, progesterone is turned into something called allopregnanolone. And allopregnanolone is basically like taking an anxiety medicine like that. Makes you feel calm and happy and a little bit better to cope with what's going on. And that's great while you're pregnant, but the baby's born, the placenta comes out, and those hormone levels crash back down to zero. And suddenly your brain is saying, where is my happy hormone? What is going on here? And that's why you're trying to figure out how to feed your baby and how to function with no sleep and how to manage a whole other person, not to mention recovering from birth. So what I want you to know is if you're feeling crazy, it's not because you're doing it wrong. It's because you're experiencing the biggest and fastest hormone change of your life. Know that you are not alone. You are not to blame. And with help, you will get better. Please also be gentle with yourself and ask for what you need because you're worth it and you matter.
So when we actually created with the fourth trimester, thinking about those hormones in the process and what actually happens, for me, it would have been great to have like those snippings and then just knowing that hormones are even present and that the changes are happening and that also that they could lead into mood disorders and thinking about the different aspects of those pieces. Let's see next slide. So when we think about what are PMADs, we know that there's anxiety, bipolar mood disorders, depression, obsessive symptoms, postpartum psychosis, post-traumatic stress syndrome disorder. And then for baby blues, we think about mood swings, excessive worry, overwhelming, wanting to be left alone, tearful or sad or grumpy or easily irritated. And when we think about these two groups, we don't often consider the different teens or the different groups that we might provide care with. And that we want to think about, especially, is thinking about teen pregnancy and thinking about mental health and how we're supporting individuals that have navigated teen pregnancy and also lactation in that time period. And so I'm going to actually ask Bernadette to come in and share some of her story at this time.
Okay. Well, as a teen parent, I would say I was 16 when I had my son, going on 17, and it was a little easy for me because a newborn baby, everybody loved the baby, so forget about me. It was all about the baby. So I basically could come and do what I wanted to do as a teen mom. I had a little bit easy, but when I had my second baby at 18, everything came crashing down. It was um, where was I going to stay? Who was going to help me? How was I going to breastfeed both babies at one time? Um, so it became really hard for me as a teen mom. I was working and going to school. So when I wasn't going to school, I was working. When I wasn't working, I was going to school because I had to take care of two babies. And I didn't know about tandem feeding until I got with Breastfeed Derm, and so that was a new word for me. Thank you, love. Um, but I was breastfeeding two babies at one time, a 1 year old and a newborn, and it was hard for me as a teenager, but I did it. Mood swings. I There were times where I would just bust out crying because I didn't know whether, what was going to be my next move, what was going to be my next intake. How was I going to do this on my own? Um, when I thought I had to do it on my own, but I didn't know that I did have people that was out there to help me. I just didn't ask, because I was, as a teen mom, they make you feel ashamed. Some people just shame you on that. You're a teen mother. You didn't have a second child. You shouldn't have did that again. So now it's one of those look down upon you when they didn't realize I was still working and going to school and trying to make it with these two babies. But so I had a lot of depression. Um, I had a lot of depression where I I wouldn't say I didn't want my babies. I just wanted to just get rid of them, just let somebody take them for a couple of months or a couple of days, so that way I can get myself together. But it didn't happen. I pushed forward. I kept my babies, and I made it in another state and brought them down here. As they were babies, I call them my hip and my leg babies because I had one on my hip and I had one on my leg and two duffel bags and moved down here, and they were still breastfeeding. I was still breastfeeding them, and I found my village that helped me. My village helped me with my depression. My village helped me with resources that I didn't know that North Carolina had. So without my village, without the resources, I would probably still have been in the depression stage. So so I would just say a village helps you. Getting that help helps you. But I was a teenager and I did have that depression with both of my children.
Um, well, thank you for sharing that, Bernadette. I'm gonna let's talk about what perinatal depression and when that actually happens, and I'll come back to you in a few minutes, okay?
Okay.
Awesome. So when we think about perinatal depression would be characterized as depressive episodes that occurs during pregnancy or within the year of birth. And the onset can happen at any time. Pregnancy, the first year of the postpartum period, and it can also be triggered by weaning or when the menstrual cycle resumes. We can see change in appetite, sleep, energy, or motivation or concentration. There's also connection between negative thinking and including guilt and hopelessness, and worthlessness. It's one of also considered some of the maternal. When we think about warning signs, those could be connected, would be helplessness, and then it also could be experiencing like suicidal thoughts. So these are always things that you want to make sure that we are actually evaluating for. Individuals that are at risk for postpartum depression are individuals that have history of perinatal mood, anxiety disorders, thinking about personal family histories of depression, um, also having big life changes or a lack of social support, having multiples, difficulty with pregnancy, also having a difficult infant temperament, and then special needs are individuals that have NICU babies and then infant loss. Perinatal depression occurs in about up to 20% of all new mothers and birthing people, and it's about 33 to 50% individuals that are identified as low socioeconomic status. For postpartum depression, some of the there's common medications and treatments that can be provided, and also we'll provide more information in a couple of slides about that. When we think about perinatal anxiety, there's a range of anxiety disorders, including generalized anxiety, panic disorder, and or social anxiety experienced during pregnancy or the postpartum period. And this can also be triggered by weaning or the menstrual cycle. Thinking about things like fear and anxiety, panic attacks, shortness of breath, rapid pulse, dizziness, chest or stomach pains and aches, the fear of detachment or doom, fear of going crazy or dying, all those things could potentially happen. Sometimes deliberating or worrying a lot. And then you may also have intrusive thoughts. Generalized anxiety occurs in about 68% of individuals, and about panic disorders could happen about less than 1%. And then there's also social anxiety that happens about less than 1% as well. For individuals that have history of perinatal mood and anxiety disorders, those are risk factors, any big changes, very similar to postpartum depression. Um, the same symptoms can also occur. We think about obsessive compulsive disorders. It's those intrusive, repetitive thoughts that are scary and they don't make sense to mothers or the expecting mother. Compulsions may be present and then also triggered by potential waning and menstrual cycles. And then some of the risk factors could be those same things with life changes, difficult pregnancies, and then lack of social support. Our next one is post-traumatic stress disorder. Thinking about specific anxiety symptoms, including nightmares, flashbacks, and hypervigilance. Experience traumatic events, including traumatic births. And the onset can occur anytime during the pregnancy or in the first year. And the peaks at about 3 to 4 months in the postpartum period, which can also be triggered by weaning. Thinking about changes in condition, cognition, mood, arousal, associated with traumatic events and avoidance of certain stimuli could be some of the potential things that might be present for those individuals. And then some of the actual risk factors could be the risk factors for depression, anxiety, and then also the traumatic birth as experienced or previous sexual trauma can also be risk factors. For postpartum psychosis, it can be the sudden onset of psychotic symptoms following childbirth, particularly delusions regarding self or children, and increased risk with bipolar disorder. And this usually occurs between 2 to 12 weeks after delivery, and we want to make sure that we're watching carefully for those individuals that are sleep deprived for more than 48 hours. There could be mood fluctuations, confusion, marked cognitive impairment, bizarre behavior, or hallucinations and auditory hallucinations, and may have moments of lucidity and may include some delusions as well. Then we think about some of the risk factors for postpartum psychosis. That could be bipolar disorder, history of psychosis, history of postpartum psychosis within this time period, and then family history of psychotic illness, severe sleep deprivation, and then discontinuing medications for bipolar could also contribute to postpartum psychosis. When we think about treatment and management, the NC Matters actually has a whole toolkit on postpartum or anxiety and just treatment and management together for all. But these are some of the common medications and treatment options, and we'll have options to receive these slides, and you'll have connections and contact for the additional information related to the actual treatments for that. But now that we've talked a little bit about kind of the kind of bigger picture of what that is, I'd love to hear more about your story as you're thinking about navigating postpartum depression and what that was like for you as you transitioned down to North Carolina and finding support for that.
Okay, I would say I'm going to start with the first two were, we took care of that. That was fine. But when you were talking about the prenatal, the perinatal, and all, and the anxiety, depression, all that, I went through so much, with all three of them, my three last children. My son, Isaiah, the third baby, I had gestational diabetes. I had food poisoning. I had to stay in the hospital. Um, I had to find some place for my older two children to stay. So I wanted to keep them while I was in the hospital. I went through a lot. I would find myself coming home from the hospital, sitting in the middle of the floor in the kitchen with the refrigerator open, just crying. Um, my depression through my pregnancy with my third child was very, very hard. Um, and I didn't have any help. There was no programs that I got in contact with, nobody that I would talk to. It was just my church home that helped me a little bit. But far as I stayed in the hospital with my third child. There was no, it was like come home for a couple of weeks and right back in the hospital because my diabetes wouldn't, I couldn't keep it under control. I was always sick. I was high blood pressure. I just went through a lot when I was pregnant with my third child. My second one, I said my second one. My fourth one, um, I went through some stuff with him as well, with the still gestational diabetes. I did wind up getting some mental help with him. I went through some depression with him during pregnancy as well. But I think what happened was when I lost my mom, that took me over the edge. When I lost my mom, and then after losing my mom, my grandmother, that both of them, back to back, just literally took me over the edge to the point where I couldn't call nobody. I couldn't call them anymore to say, "Hey, grandma, what do I need to do? What's going on? The baby's doing this. I'm not. He's not latching on right, or talk about my mastitis or just things like that, and just to get that advice from my mom and my grandmother. Depression, you couldn't get me out the house.
Hmm.
You couldn't get me out the bed sometimes. Even though I had other children to take care of, there were times where I wouldn't be able to do anything. There were times where I just did not want to do nothing at all. Pricking my finger was just, I was tired of doing that. So I had to go to the hospital with him, with the fourth child. So my depression was very bad when it came down to pregnancy, the prenatal, and the postpartum.
Hmm.
It was but I did, it was going to mental health. I was getting help from organizations, but it kind of still, they didn't help as well. Having people coming into your house and judging you because you have those days where you don't want to clean up. You have those days where you haven't taken a shower because you got two babies. Here again, I got two babies right behind one another and taking care of two older ones. I didn't feel like doing anything. So it was one of those, instead of you saying, how can I help you? You judging me. So I didn't want to, just, it was just one of those, get out my house, don't come back. So I went through a lot when I was pregnant and after, during pregnancy and after, with my other children as well.
Can you share the supports that were helpful to help you as you navigated the process, especially as a teen, to continue breastfeeding and with like the lactation support that you needed, and as you navigated perinatal depression or postpartum depression and your situation?
So with as a teen mom, I started with my breastfeeding was with when I had my first one. So he was just, I breastfed him until he was 6 months. And that started from a program that I was in a nonprofit organization that I was going to, but I was also working for that one as well. And it was a teen program. And I was able to take my child to school with me as well. And they
Mhm.
were happy to allow you to breastfeed too. But when I had my second child as a teen, I was 18, her dad wanted me to breastfeed. He was like, you're not giving her no formula. You're gonna breastfeed her.
Mhm.
So when we told the doctors and the nurses that I was breastfeeding, they brought a VCR TV and we had dinner. They brought us dinner, a steak dinner. And they were happy. Like they were like, you're 18 years old and you want to breastfeed and we don't have to say anything. So they were even more excited about a teenager breastfeeding.
Mhm.
So for me being a teenager, that's what helped me, is that I found people that were on my side with breastfeeding. Um, when I came down here and had my other three children, because I knew about breastfeeding, because of experience, I was like, we're going to breastfeed. Their dad wanted me to breastfeed him too. So I was like, we're breastfeeding. Um, the help that I did get was Welcome Baby. Welcome Baby helped me. Um, it was another program that helped me. I can't, they're not open anymore, but it was another program that helped me because I went to school, as they call it, parenting classes.
Mhm.
So they helped me. And I can say some of um Triple P, some of the people that work for Triple P did come and help. So I did have a couple of people from Triple P that
Mhm.
came out and helped.
So having resources from lots of different places and within the community helped support you as like with lactation and just navigating that process. I know
Yes.
it's been a little while, but when you think about your sleep, and what was Can you remember like just getting sleep or what that was like
What
as a teenager?
sleep? There was no sleep. There was no. I
Uh,
mean, well, as a teenager, I didn't. I had sleep because I didn't really have my baby. They came and got
mhm,
my baby every time he cried. They came and got him. There was no he's gonna cry. I'm coming to get the baby. He wasn't my baby. He was there. He was everybody else's baby. Um, I I did get sleep with my I got sleep with both of my babies as a teenager because like I said, it wasn't my baby. They weren't
mhm,
mine. Everybody wanted them. When I moved down here and had my other three, there was no sleep. What's you know,
mhm.
I had to have them. They were right there. So there was nobody coming to pick them up and coming to take them. I had to be with them 24/7. Um, and there was no working. There was being at home with them, taking care of them, and no, there was no sleep. I have been in the bathroom with them, in the bathroom taking a shower, and and with one eye open and one eye closed, and with that eye that's open because the baby is in the bathroom with me in his car seat. So
Yes.
no, that my sleep was I didn't get no sleep.
I know that when you think about perinatal mood disorder and sleep, there's a huge connection between that. We know that the physiological changes of pregnancy can make sleep difficult. And then we have about 75% of pe pregnant people in the third trimester have disturbances there. And then when you come into the postpartum period, especially if you're lactating and you're having trying to balance nighttime parenting and feeding at night. And we know that individuals that are able to get about 5 hours of sleep are able to do better and to kind of navigate the mood disorder period, especially if you have sleep patterns. What are some of your suggestions as we think about lactation support that can help to increase sleep during this time, or some things that helped you during that to be able
My
to?
my grandmother always told me to sleep when the baby sleeps. Um, that's the best thing that you can do is sleep when the baby sleep.
Mhm,
Um, I have found myself going to sleep with the baby and having my breast on one side and the baby right there where he's like right there on my breast and we will both fall asleep together. But even though I still got that one eye open, but still we would fall asleep together. So it would be sleep when the baby sleep. That's how you're gonna get
mhm.
your rest. At least do that 10-15 minutes sleep.
Is there anything that, so for individuals that have like maybe that postpartum anxiety or like those, I know for me personally, I was the one that was sitting up. I can remember vividly my husband looking over at me and saying, "I'm sorry, son, that you can't go to sleep because your mother is staring at you, making sure that she heard your chest is going up
Yes.
and down."
Yes,
And that anxiety.
your ear is near the chest, and you're trying to hear the heartbeat to make
Mhm,
sure, or you're looking to see if the chest is going up and down. You're doing the breathing test. So for me, you're going to do that. There's not a mom that's not going to do that. There's not a mom that's not going to make sure that that baby is okay. Um, every night, every minute, every hour. You're going to make sure that he don't have or she don't have milk coming out one side of the mouth, after you them fed them. You're going to make sure that they burp. If they haven't burped, you're going to burp them until they burp.
mhm,
So you're just going to be a mom, and you're just going to make sure that you know that your job is never done as a mom, that you're going to make sure that that baby is okay.
mhm. And then making sure, I think kind of going back to the beginning, like where you said the people that you had around you, having that village to support so that you could find those breaks to get. the naps if possible.
You need a village. If you do not have a village, then take your minute when that baby go to sleep.
Mhm.
But if you have a village, lean on your village as much as you can. Lean on whatever support that you have as much as you can.
Mhm. Awesome. I'm gonna go back to a few more slides, okay? So one of the things when we think about just postpartum screenings and thinking about the conversations that we're having, one of the things is to know the fears. Like if I have a score that's too high or on the depression scale, will they send me to an institution or are they going to take my baby away or are they going to actually answer the question appropriately or just will they do they know the answers to the questions to actually be able to capture what's needed related to anxiety and depression? Um, and then we think about the different tools that are available. There's the Edinburgh, and then also the PHQ-9, and then other things to think about. How do you actually capture generalized anxiety, especially when you think about individuals within the Black community and how people are actually answering conversations and questions. With some of our recent studies and conversations that we've been able to have with individuals, they've said that they've looked at tools and they've been concerned about actually how they answer the questions. If they're going to tell the truth, like if not necessarily, are they going to actually relay what they are feeling, especially when it comes to nighttime parenting, or if they have concerns, if they've had a history of mood disorders or other concerns, they may not necessarily answer the questions because they're concerned about being reported and not necessarily being able to have their baby to go home with them. Was there anything else you wanted to add with that, Bernadette, before I go to the next slide?
I just want to say you're so correct. You're going to there are times where I made sure that I didn't say anything that was wrong because you don't know sometimes how to answer questions. Um you don't know what they're looking for. You don't know you can say if you're doing a baby's bath, the way that you was taught how to do that baby's bath, they may not have been taught that way, but that's the way that you were taught. And you're gonna cringe a little bit because you don't know if they're looking over your shoulder. It's the over the shoulder part. Everything that I say or everything that I do, is it wrong? Is it right? Are you going to take my baby from me if I say the wrong thing? So you're correct. I have many a times been in that situation where I was scared to say too much, but not but too little as well.
Mhm.
So so yeah, that part right there is a number one factor, especially in a black home. You don't know who is going to be for you and you don't know who's going to be against you. So you don't know what answers to really answer, and if your answer is going to be the answer that may take your baby away from you or may have somebody come to your house and just to see how things are going in your household.
Mhm. So
So
we
that's go ahead.
So I was going to say, it sounds like based upon that conversation that you're having, that there could be individuals that are not getting the treatment or care that they need because of the fear for screenings. Do you have any thoughts about how we can make sure that um, people do get the services that they need?
Stop judging. Don't judge. Be open. Go and just be open to that person and let the person know that you're there for them. You're not there to judge them. You're not there to do any harm. You're just there to help. Um, because a lot of us don't think that you're there to help. We just think that you look at us and say skin color. Look at us and say the neighborhood we live in. So stop stereotyping and just be there for us and let us know that you're really there for us.
Well, 1 in 10 fathers actually experience depression or anxiety after the birth of a child. And I know that in North Carolina, there was a huge study that was done with Head Starts to think about individuals that had that delivered and they were diagnosed with postpartum um, depression, and they actually looked at the household to see, and they found that not only did their partners have an increased rate of of depression during that time period, but also individuals that were just providing support could also have an increased rate of that. So making sure that we provide the education about what to look for, thinking about whether it's the warning signs that where there could be maternal mental health concerns. I know one of the when we think about the warning signs for mental health is think or for maternal health is thinking about if you hear things that no one else hears, but if you don't actually have anyone around you, you don't know what anyone else hears. So making sure that we're training everyone around us and everyone is aware of what to have there, but then also what supports are available. Um, and in North Carolina, there is it's North Carolina and nationally, and there's the boot camp for new dads, and thinking about, one, having them as they start to bring their babies home, what supports they can do, what role can they play as they work through this process. I know for me, nighttime feeding could have been, was challenging, was just trying to find that kind of rhythm. And then my husband would come in and say, well, I don't know what to do because I can't feed you. I can't do that, but what can I do? But being able to have like a resource to actually say, how can you make sure if that he would have known that I needed to have at least 5 hours of sleep, maybe thinking about how to help kind of get those things together and actually equipping them with the tools that are needed, to be able to go through this process, is one thing to consider. Another piece is thinking about the actual birth trauma that happens. And we know that some individuals experience events during childbirth that would traumatize any person. We think about it's not always necessarily a dramatic event or a trigger that can actually cause this um, postpartum um, I'm not postpartum, sorry, PTSD. It could be anything. We think about simple birth trauma. It could be and I've had a plan or I had a type of delivery that I was expecting, or things didn't go the way that I anticipated. And we think about those pieces. All of those things can contribute to how they experience another either another pregnancy, another birth, or even just your postpartum period, what that looks like. All those things can come back up. So, providing support and being able to know how to navigate that. One of the facilities in our perinatal region, we worked with creating a supportive birth services. It's a session where it's a trauma-informed care where you come together and they utilize CRIM and think about they've trained the healthcare team, specifically in motivational interviewing and other trauma-informed care processes to think about how you can support individuals, either if they've had a previous loss or they've had some type of traumatic experience, and they come in and they think about what their birth preferences are and think about how we can actually prepare for the next experience, whether it is the pregnancy, but also considering what happens in the postpartum period. What can we do to actually help you be more effective? Be prepared. It may not go the exact way that you want or the way that you desire, but you have the resources and the village around you to help supporting that. And then as we created that session, one of the things that came out was that caring for the individuals and families, that oftentimes we don't fill up ourselves. We don't think about what our favorite coffee or warm drink is. We don't actually put back into ourselves, especially as we stay up late nights helping people to transition through this period. And often we can experience secondary trauma. And once we start going through that or even burnout, we start creating systems that might prevent the care that we want to do because we haven't refilled ourselves. So one of the other resources that are available is thinking about the care for the caregivers, thinking about strategies. This one was specifically for nurse leaders, but there are other sessions, but thinking about how you can address um, burnout and pulling the things together, and how do you care for yourself in as it relates to mental health, because oftentimes we are caring for our the ones that we love, but then also going back to work after a delivery or after going back to work after we've experienced some type of mental health, and we're not caring for ourselves the way that we did. We spoke to about over 300 healthcare team members. And when we went through to look at the themes, we noticed that there's a large amount of um, anxiety, depression, and just mental health concerns that aren't necessarily addressed. And these are individuals in North Carolina and across the nation about how they want to provide the best type of care, but they don't have all the resources to help make sure they're okay. And so being able to make sure we pour back into our cup is one of the key pieces too. One of the ways that we were helping these individuals as we think about that we're providing support to navigate this process was using the iChill app with CRIM, with the community resilience model, actually help you to reconnect with yourself and to kind of center yourself before you walk into stressful situations or before you start to having to provide those different types of care. And so this is one resource that's available. I know we just talked about like that birth trauma and piece, and now, Bernadette, I think we were going to transition, and you wanted to share some about Ebony's story and thinking about navigating trauma and support.
Yes, but before I do start with her story, a little bit
Mhm,
about her story, I would like to say, going back to the fathers,
mhm,
communication
mhm.
is the number one key. I've because I've heard this. I'm speaking from experience. From what happened with me, I was always told I can't read your mind. What do you
Yes.
need me to help you do? You know, what do you want me to do? I cannot read your mind. That would be the number one thing that I would always hear is
Mhm,
that I'm not a mind reader. So it's communication is the key factor because they're not prone to knowing what we need, you know. I'm just being honest. They're not. They just look at us and say, "Well, like you just said, well, I can't help. I can't feed the baby. What am I supposed to do?" So, it's communication. If you don't have that communication with them and communicate with them, they're not going to know. They're not going to be able to help the way that you want them to help.
mhm,
You will find yourself not getting that 5 hours of sleep. Um, or that 3 hours of sleep. So, or that dishes need to be washed. You know.
mhm,
So communication for a father is well known that needs to happen. But getting back to Ebony, which is my daughter, she's 29. She had her first child at around 21, 22. And we went to the hospital, well, went to the doctor thinking that we were going to find out the sex. She was 5 months pregnant. And we did find the sex out. It was a little girl. And the doctor said, we have to go to the hospital, see you to the hospital because the placenta detached. So we went to the hospital and they did all these testing on her, gave her all this medication, and told her not to get out the bed. That the baby was deceased in her, and they didn't want her to get out the bed. They were going to get her to have the baby, and we were supposed to. They gave us a box and said, this is a box for you to put the footprints on for the baby." And I would say not even the next day, she had to go to the bathroom. As I said, they put her on bed rest. The nurse came in and said, "No, you can get up and you can go to the bathroom." And as we told her she couldn't get up. We advocated for her. She advocated for herself. And she just got to the point where she said, "You know what? I have to go to the bathroom. I'm just going to go ahead and get up." Well, as she got up, everything rushed out of her. It was just so much blood that came from up out of her that we did not know that the baby came out too. Um, They called a housekeeping to come and clean it up. And as housekeeping came and cleaned it up, put everything in the garbage, the doctor came in later on after that and did another ultrasound and said that gave us a time of when they were going to go ahead and start the procedure. They wanted to do another ultrasound. They did another ultrasound. The baby was gone. Um, by that time, we were losing our minds. We didn't know, we're like, what happened? All the doctors and nurses are running around, did not know what was going on. They had to call the chief of staff off his vacation from playing golf to come in to find out what was going on. And the baby was thrown in the garbage. Um, and that was all we heard from that. She was crazy. There was no baby. So it was just a lot. And the box that we had, we did not have a box to bring the baby in. So that was just something I'm not, I don't want to tell her full story, but as a mom, seeing your baby go through something like that was very, very hard because I didn't have answers. So when she was saying, Mom, why, what, just all these questions, I could not answer her. I could only just be there for her. Just hold her and be there for her. But I had questions myself. So how could I answer something that I didn't even that I had questions myself for?
Hmm. Yeah, so
But that was just something we went through.
when we think about that, I think that type of like the trauma and support, what would it have looked like for you to have received respectful care?
Say that again.
When you think about the scenario that you just went through, or just the whole process that you described, it sounds like there is a lack of respectful care. What would have it looked like for you to have received
There was a
respectful care?
there was a lot of lack of respectful care. It would have been I don't know. I don't know. I can't answer that question. I
How,
can't answer that question.
what do you think? How do you describe respectful care, especially when we think about lactation and mental health and all those pieces
Respectful
of
care
care?
is to me is just not not looking at my health insurance, not looking at where I'm come from, not looking at my skin, treating me the way you would want to be treated. If you were in my situation, in her position, in her situation, how would you want to be treated? So treat me the same way that you would want to be treated. You would want me to treat you with respectful care. Treat me with respectful care.
Mhm. Awesome. Thank you for sharing that. Now we've talked some about trauma and some of the things. So we're gonna now kind of transition into some of the resources or the tools and things to get ready for when we think about how to navigate lactation and what supports do we think are needed and how can we make this transition in the postpartum period.
I can say I want to speak on
Mhm,
that with my daughter.
mhm.
The trauma. She's still going through it. You know, she does have my granddaughter. My granddaughter's 7, but my other granddaughter, she wound up getting pregnant. I would say 6 months later, but she's still going through the trauma. I see it. There are times where she breaks down and she remembers and cries. She remember the dates that she went in the hospital. She remembers everything, and so she hasn't gotten help, but she needs the help. She doesn't like to talk about it because she doesn't want to remember. And there were some things that she told me that I didn't even know that happened in there because she was telling me the stories that I wasn't when I wasn't there. That's why I said she has her own story. And my mouth just dropped. It was like, I did not know that that's what you went through while I was gone.
Mhm.
So hopefully and prayerfully she can get the help, but she's still going through her trauma.
Mhm.
And when we don't get that help, we're going to keep going and keep going, and we're going to keep going through that. If you don't get that help, regardless of how old you are, because that sits in you and it's an instill that's in you. And it's a hurt and a pain that you're not going to get rid of if you don't get the help, get the healing as well.
Yeah, so making sure you have that support and then also finding out how to have mental health support to
Mhm.
transition. Thank you. So I'm gonna transition talk about anticipatory guidance and thinking about how we can help or like what to tell people to be prepared for when we think about postpartum and how that can impact their care. So back to slides. So we know that anticipatory guidance. So we know that individuals can definitely be caught off guard just from the postpartum experience um, in general, but then when you compound it with the experience of perinatal mental health support that's needed, lactation support, and trying to juggle and balance all those things together, um, it's often helpful to be able to have those conversations ahead of time and think about what is actually needed, and you're more likely to be able to continue and navigate the process. One of our colleagues, Dr. Elizabeth Howell, actually has a session where they provided 15 minutes of anticipatory guidance. And so thinking about what it means, like if you're going to experience what it means to be feeling sad or baby blues or depressive symptoms. So actually thinking about you might have these experiences, especially if you've had a risk factor ahead of time. And then thinking about just talking about if you were going to have a C-section, what that pain site might look like or feel. If you have breast pain or if you even had thoughts about lactation, what that might be when you have those conversations ahead of time, you are more likely to reduce depressive symptoms through 6 months postpartum period because they knew what to expect, or they knew if they may not have known what exactly to expect in that period, but they knew if they needed support or if they needed to reach out to have additional care, things to look out for. They were able to have a more understanding of that, but then they were also able to understand what to do in that period that helped them to increase their breastfeeding duration. So if we are able to provide the support where you're able to provide either either a postpartum education course or having different sessions. Those are things that can be helpful to help navigate this period. One of the facilities in our region has actually created a postpartum course that happens for individuals to come back after they've delivered. And that course, they talk about the postpartum period, and they also think about the different challenges that they may have to navigate before. And so they can either come in the postpartum period, but some of them are actually coming in during like in their prenatal period. So about between anywhere from 32 to 35 or 36 weeks, they come in and they start talking about postpartum support and what supports they might need related to lactation or what supports they may need for mental health, and actually creating plans so that they have the village that it's created and be able to have those conversations. A lot of times people don't realize how long and how far out problems from postpartum can actually last. Um, and these are some of the things that we don't think about that could actually impact not just our bodies, but when you put them all together and we think about the mental health and the exhaustion and all those things together, that also can contribute to just being for depression, to the different symptoms. And then some of the other pieces is having those conversations ahead of time, helping you to normalize and bring up those sensitive issues, whether it's physical recovery or if you're concerned because you're hearing things that other people don't hear, like being able to say, we feel comfortable that that's not going to cause something to happen to you, but to actually share those concerns. Or if you're not resting, oftentimes we think that We hear we need to rest when the baby rests, but we don't know how to do it, or we don't know what to do in order to do that. And so, offering support during this time, especially with as individuals come in and have those conversations. So, thinking about how we have conversations, whether they're coming in for a postpartum visit or if they're just coming in for a breastfeeding check, to say, "How's sleeping going?" And oftentimes we'll laugh and say, who sleeps? Like, do you ever sleep? I know when I'll talk to my mom and she'll say, "You're never gonna sleep again until like if you're 40 years old and I still don't sleep the same way." But thinking about what are you actually getting those moments in? And Bernadette, I think I see you shaking your head. Did you want to say something before I go to the next section?
No, I was just saying, agreeing with you. Like as I said before, you hear grandma say sleep when baby sleep. But like you said, sometimes you don't want to sleep when the baby sleep because you might have to clean up, you might have to cook. Those are your times where you might have to do some things that, if you fall asleep, it's not going to get done. So you're like, how can I fall asleep when the baby sleeps? Because that's what I would say. That's what I used to say. Grandma, I can't sleep when the baby sleep. I gotta clean up. I gotta cook. So it's always those things.
Hmm. Yeah, but being able to provide that additional support to actually understand. And then also, there's the Hear Her campaign has different resources. Some individuals don't feel comfortable advocating for themselves or helping them to get this resources that they need. And with this campaign, there's stories, but there's also a little pocket guide on and tips and techniques that you can give to individuals to actually help them advocate for themselves, kind of giving them almost a script of what to say when they're concerned about what needs to happen with for them next. And then we know that we have the National Maternal Mental Health hotlines that are available to help for individuals as they go through this process. The the mental health line, but also Postpartum Support International, and thinking about those sessions that are there's race concordant groups that are available to help have conversations related to mental health, and then thinking about just forming what other resources and groups that are available to help think about lactation. Oftentimes, we've had where people will come in and have conversations about lactation support, and then once those groups come together, they start having conversations about how they're feeling, how they're sleeping, and then actually being able to navigate the bigger feelings that they might have, or if they need referrals, that's also available as well. And so you could consider the different types of support as having sessions that are co-led with mental health therapists or individuals that have been trained in mental health with a lactation consultant to help have both those conversations and at the same time to be able to actually see results for them. We also know that maternal mental health matters. NC Matters here in North Carolina. They are available for individuals to receive support through telehealth. They also have trainings that are available for healthcare professionals and individuals caring for pregnant postpartum families in North Carolina to give additional resources related to navigating mental health as well. As we talk about just the process of going through. It's one thing also to remind individuals that have that are navigating the postpartum period, but then also um, they may need help with mental health is thinking about being mindful for themselves and taking a moment and actually allowing themselves to do whatever refills their cup, especially for first-time parents or individuals that have been trying to navigate it by themselves without a village, finding ways for them to think about stress reduction, being able to focus more and not have to worry about getting all the things right at once. Just each journey in itself can be a task and challenge to kind of go through. So making sure that we are able to think about taking a moment and stopping and asking that question, like, what's one thing that's gone great today for you? What's one positive thing before we actually start having those conversations related to all the other pieces? That can happen during a follow-up appointment or even when they're coming in to just making that connection so they can stop and really think about one moment, what's one positive thing that we've had and how can I be more mindful? For individuals, this is another training for individuals that have history of opioid use disorder and being able to think about what supports are available and how they navigate those different experiences. I know recently being having conversations with some of our parent and lived experience individuals when they have the conversation about mental health and they have a history of substance use disorder, actually being able and feeling comfortable to actually answer one of those screening tools or questions or things about nighttime sleeping and lactation and parenting and all those things when it comes in, they have a different awareness. And when we were having those conversations with them, some of them said that they didn't feel comfortable answering tools or screening assessments because they weren't sure what was going to happen to them and thinking about the what negative impacts might have and that to them if they did answer it correctly. And that's one challenge that we have, making sure that they get the care that they need and the support that they need without having fear integrated in that as well. And then this is the more information about that substance use line, substance use specialist for support and thinking about our pull-up and our beds that are available, but thinking how can we have that additional support. Then you also mentioned building your village, making sure that you have a team wrapped around this. And I know, Bernadette, you mentioned something about fatherhood, and I know that's one of your areas is thinking about the different teams, but making sure you're able to build a community of support around individuals during this time period, and being able to have supports and everything together, and making sure that we're able to have fathers engaged is a key piece with the care and support during this time. Um, One of the other challenges that we notice, we often say reach out, make sure people are asking for help, that they're getting the support that they need. But what we found is when we're talking to individuals, they don't know, one, how to ask for help or what to ask for help or feeling comfortable in actually doing that. The Rose program is a program that is a prenatal session and one postnatal session that is an evidence-based session that they have topics on psychoeducation and postpartum depression and managing the transition to motherhood and parenthood. And it's Reach Out, Stay Strong Essentials for Mothers and Newborns. And it's actually they actually provide tools and tips to encourage individuals to one, navigate this process, but also how to ask for help. When we think about the Superwoman schema, that I can do all the things, and all the other pieces that prevent us from actually asking for help, those are things that sometimes we don't think about actually needing to teach or train on how to do or in a course. But this is one example of something that can be integrated. It's within the right now it's through the Veteran Affairs, but this is another area that's been shown and proven to provide support that's been effective with that. And so I've shared a couple of those different sessions, but Bernadette, let's hear about what community support's available with Breastfeeding Durham.
The community support that's available are we have MAME, we have Equity Before Birth, we have the health department, um, and we have the community itself that is that is supporting breastfeeding and that is supporting the families.
Awesome. Is there anything else that you wanted to highlight from for Breastfeeding Durham? Um,
And also we have our daycares that support breastfeeding as well. That we have set up their lactation. They're wanting us to set up lactation spaces in their daycares now. We have different businesses that are calling us or emailing us and saying, "Hey, we heard about this lactation space. Can you, or we seen one at one of our partners? Can you come and help set up one for us?" So a lot of the businesses and daycares are now wanting us to come up and set up the lactation spaces for their families, for their employers. A lot of the door to doors that we go out that wants to that are open to having their employees breastfeed or well pump and some breastfeed at their jobs. So even the customers can pump, or can if they want to go into their room and you know how they wear they like to wear their little new ones.
Yes.
I don't like that because they didn't have it for me. So the ones they have with the moms can walk around and pump.
Mhm.
So and or just breastfeed their babies. So or chest feed. So we just have it where now it's about to be a norm for real,
Awesome.
even in our parks. So we have our signs in the parks as well. So it's about to be an actual norm now.
Awesome. Well, I'm going to share just a few more of resources with the postpartum from the fourth trimester tool. There's create a postpartum toolkit to think about postpartum planning and preparing for health visits, and also one pagers to kind of get ready for that process. So thinking about the actual postpartum plan, especially when we have individuals that have history um, of needing to support with actually asking help. So this is a one pager that could be either downloaded or printed at newmom.health.com. And it has different sections where it's supposed to help to actually trigger and highlight conversations that you want to make sure that you have. Thinking about communication, visitors, food, groceries, and what supports and resources do I need? And how can I actually go through this process together? There's also some prompts on the back that are related to postpartum mental health and also just mental health in general, and thinking about what they need. And on the back, there's a QR code that they can scan for additional support. The other one is the postpartum care plan. So if we know for individuals that have history of mood disorders or challenges that may needs additional support with different types of healthcare team members, this can be used when they're first getting ready, and that way they have everything listed. We found that there are a large percent of individuals that don't know who to call after they've given birth and who their supports are. So this tool is designed to give them to be kind of a process to think about what they need to know, but then also having the conversation of who can support me, who's in my village, and if I can't find anyone, if I can't think of anyone just by myself, maybe I can start having those conversations to think about individuals that are within my community that can help me to support me during this time. We also know that thinking about connecting with care and that transitions of care, making sure that we are able to get the full spectrum of care. So not just having those postpartum visits, but also transitioning from maternity to well women care, and making sure that we everyone is has full connection. And in that transition, it's also that transition with what supports are needed on the outside, whether it's lactation or if it's mental health, and making sure that we have access to those resources and people know where to go to actually get the help. The first video that we showed earlier is that can be found at newmomhealth.com with additional, another one is there that's actually related to actually asking for support and how to get help, with several different reels, but being able to know what they can have access to. And then understanding that material supports, oftentimes we don't consider how supports and resources like diapers and wipes and all the other things that are needed actually has an impact on our mental health and on our journey as we consider lactation. We also have the one pagers and handouts for people to ask questions and helping them to kind of navigate and understand what this experience might be like, and having it like an all-in-one page for both what to go to the hospital for and then how to continue to take care of yourself. And that is all of our presentation. Bernadette, did you have anything else that you wanted to add?
Yes, and also we also have our newsletter that comes out every month, and it has resources on there as well that you can get on and look up if you need to look it up, or if you need to send someone to it. Always you can always send them to our newsletter, breastfeeddurham.org, and they would have it'll tell you about the classes that we have that are free and all the other resources that we have.
So, well, I think that I'm not sure. We'll turn it back over to Amber or Love.
I mean, we still have 15 more minutes before we officially end, and I was
Okay.
wondering if anyone has questions. If is that okay? If we do a
Yeah.
couple.
Hmm.
Yep,
I
that's perfect.
I was thinking when I heard that, I mean, first of all, I'm thinking of my own postpartum journey. I was like, I thought everybody was afraid that when they drove over the bridge that they were gonna drive off the bridge and like which child would you unbuckle first when they're both toddlers and who would I save? Like I thought that was just normal and we were all
Hmm.
living in that fear. Um, but I really would love for you to expand and talk more about not over like how do when I'm supporting parents, how do I appropriately support them and differentiate from, I mean, I think Allison Stu, we talked about that normal
Hmm.
mood change. Like we're all going to have a certain level of struggles, but what are the places where I, as a provider, need to recognize the difference between some of the fear and anxiety and lack of sleep that all of us have versus when we need to intercede. And I'm like, I'm hearing that, especially the 5 hours of consecutive sleep. I'm like, do I get that now? My kids are, and they'll say, I don't know.
I know, I know. I think so. One thing I would say, I know that I dropped in the chat in the box the actual link to the NC Matters. So for sleep specifically, they actually have a sleep assessment tool that actually can help you that you can use to guide your conversations around how much sleep. Because I know I saw five. I think their number is five. I think I saw the number three somewhere. Like my number for me to be okay was 3 hours. But having that conversation about what having what actually doing an assessment on the tool, the sleep that's actually taking place. But then also, if you're giving out any Edinburgh tools, but also realizing that sometimes that people do have those questions, like they do know the answers to the question, and then but continuing to kind of be more vigilant about, well, like how frequently are you sleeping? Thinking about what how they're actually navigating the process and the time, and then having more conversations about what their experience. Oftentimes, I know for me, when I would do home visiting, one of the there's a mental health kind of tips. No, it's a book that you can use that has like worksheets and but it's more of having more of a conversation than actually doing a complete assessment so that people feel more comfortable actually talking about their experiences. And then I found that when I was actually having the conversation with them, that they'd be more likely to say, "Yeah, I stayed up all." They might say I stayed up all night, but then they would actually have the conversation and say, "Yeah, I put the baby down at 9, and then I did this at 4, and then I did this." I said, "So what I hear you saying is that you didn't go to sleep at all last night." So really focusing in on that sleep from that perspective, but then also thinking about what if they're thinking about the different questions that they ask. One of the things that one of our colleagues is she studies depression and anxiety specifically in the Black community, and in her research, the Edinburgh tool actually did not pick up the positive depression screens because it came across more as anxiety, and the way the questions are answered or framed, they didn't necessarily resonate with the particular group. And so making sure that you're asking the questions if you have concerns or if the scores are connected or related to it, making sure you're able to kind of navigate and have more conversation, and then making the referrals if you feel like more support is needed, so they can have extra conversations with NC Matters. They can get on with the line and have conversation, and then if additional referrals and support available, you can do that as well.
Thank you.
Mhm.
Susan, did you have a question?
Yeah, I just wanted to add, I'm kind of new to this group. I'm actually an occupational therapist and I work in the NICU at Alamance Regional Cone Health in Burlington. And I kind of have two levels of interest because I work with a lot of these moms and I've had some
Mhm.
moms with really severe postpartum depression. And I try to dig for tools to help them. And, because a lot of people don't want to touch it. They're like,
Uh-huh.
yeah, I just don't want to
Yeah.
ask any questions or, oh, I don't want to call and bug her. And I'm like, and then my daughter had her baby at 21 and she had to stop lithium. She has anxiety and depression.
Mm-hmm.
And then I saw her go through it. And whew, that was
Mhm.
that was something.
Yeah.
So I kind of got like the whole life experience. I didn't have any of that when I had my two children, but watching her go through that and trying to like really hold her up and as a grandmother, you're just like, okay, now is it best that I take the baby home with me? But then I'm leaving her
Mhm.
alone. It's
Mhm.
just such a roller coaster of emotions. And you just pray every day that everybody's going to be okay. And, we're going to get through this. And we did. Um, but one of the things that I do in the NICU too, which has really helped me kind of bond with the parents, especially in these scenarios, is doing infant massage with them. So I'm
Hmm.
infant massage trained, and it's a tool that really empowers them, where they're like, oh my gosh, I feel so much more connected with my baby. And I'll never forget it when I first got certified like 4 years ago. I went into it was actually a newborn mother baby, and I did this the trigger point releases and the massage, and the mom literally looked at me and she said, "Oh my God, that was a miracle. You're a miracle worker." And, because it
Yeah.
affects feeding, it affects
Hmm.
sleep, it affects everything. It's such a ricochet effect. So, I just want to share that because I'm kind of new to the group, but I've always bonded well, and I work with the lactation consultants at the hospital, and sometimes we tag team, and it's
Yeah.
such a beautiful thing, to
Yeah.
help these moms.
Absolutely. Thank you for sharing that. I mean, and definitely thinking about the different spectrums of what's happening. And I think I know I've actually had the opportunity to help in two different regions of North Carolina, thinking about the resources that are available. And a lot of places don't want to ask the questions because
Right,
where am I gonna, if I ask the question, where am I gonna send them? Because North Carolina, we are in a desert when it relates to mental health providers. Um, if you can find one, but you may not be able to be seen right away or immediately.
right,
And so when that happens, what resources do we have to actually be able to provide the supports? And
right,
definitely finding other ways, but like infant massage, but then also encouraging like simple massages for the individuals. Like, how can I actually have
right.
that care, especially for people that are in the NICU. Babies in the NICU, with our Care for Mom study, we found that people would have issues or concerns, but they would not leave the bedside because they didn't want to leave their child. And so
Right,
they could have these depressive thoughts or concerns, and then they didn't know what to do or what to say because they wanted to dedicate their time to taking care of their baby. So definitely encouraging self-care. And from that research, some of the things that we encourage is having that whole team that like surrounding we've done really well with surrounding the baby in the NICU, but
hmm,
how do we bring in the parents that are actually there that aren't necessarily getting the care that they should or could have, and how can we redo that?
right, right.
Yeah. Thank you for sharing.
Welcome.
It, and one of the things, Susan, when you were talking that really triggered for me as I'm thinking, uh, oftentimes in my role as a peer-to-peer lactation support provider, when we do peer-to-peer support, lots of us who come to get support, we breastfeed for a really long time. And we often talk about like the grief that happens during
Mhm.
weaning. And my brain is just running with what Allison was talking about with the hormone change.
Hormones changes. Mhm.
Absolutely, that's happening when you're weaning. And I just remember being like so sad. Like I think hormonally sad, I
Mhm.
recognize now because I was like, I just feel so down now that I'm
Mhm.
but I remember being like, I am done breastfeeding. I do not want to breastfeed this child. And I remember feeling like I couldn't go to my people because it was like, I don't know who to talk to about this because everybody I know to talk to would be like, well, you should put the baby back on the breast. And I'm like, no, no, we're done. And
Right,
Yeah.
I'm not going back, but like I do feel like weird. I was like, when is this gonna go away? Uh,
right,
Yes.
and I feel
Yes.
like you don't have anyone to talk to about
Mhm.
weaning.
Yeah, I think that's another area, but that's also one of the areas when we think about the timing of weaning, and then like also like the change and transition, and what supports do we have, like just the whole support group in general, whether it's a community, and then what does it look like, especially as you not only like transition from weaning, but like as your children start to get older, and it's like, oh, do I want to go back, and having those conversations, but how do we provide the connection within our communities, especially as it relates to lactation. And then what does it look like as we build the groups together? So one of the sites that I think I mentioned, the lactation support group that was facilitated, it was actually a marriage and family therapist with a lactation therapist. That group initially was called the postpartum depression group, and nobody ever came. I wonder why. But then we changed the name. It was just the breastfeeding support group, and it was facilitated and was using motivational interviewing. So like there was a time for them to come together, and they had the conversations, and they just played and talked. But then it was also a facilitated session by the family therapist to actually have conversation about, well, how is it going? What is it like? How are you transitioning to have more than one child? Also, how is it, what's happening? With your mental health, like, are you sleeping? If you're not sleeping, what techniques and tools can we have? So having those co-located sessions, and then if something happened during that session where there was like you were asking Love, like, how do I actually know when to make that referral? Because the sessions were together, they would do a follow-up session, like with the with just the therapist and the RSA. I think that's what would it be like if you felt comfortable. Because the other piece is, people can feel comfortable as they built the relationship with the lactation specialist, but they may not feel comfortable actually taking the next step because so many things have happened as it relates to building trust. And trust is so key into having these relationships and being able to make it to actually feel open to have the conversation about it. Because some people are like, well, I should have known what depression looks like, or I should know what anxiety looks like, or I don't want to tell anybody because I don't need to tell anybody about anything.
Yeah. And I think too, as we're having this conversation, recognizing when the problem isn't depression. Bernadette and I both do this work for a reason, and both of my children have special needs, and my youngest is on the spectrum. And I remember I went to the doctor because I got 3 concussions in about 6 months, and like she was talking to me like, "Is your husband abusing you?" And I'm like, "It is the baby. Like he keeps headbutting
Yes.
me." And you're talking about the massage. I was like, if I rubbed his head like you would do to a baby like this, he would hit you with his head as hard as he
Mm,
could. And now I recognize that sensory stuff, like he needs firm touches, like don't give him
hmm
a kiss. He needs like firm pressure. And everybody was I did feel like I was going crazy, but I was not the problem. Like the child was the
hmm
problem. And I always think I tell people all the time, I'm like, these children are born who they are.
They
And
are.
then we have to figure out who they are. And like they were like this the whole time. It's just everybody else had the normal baby. And I had like we call ourselves neurospicy. Yeah, the neurospicy.
Yes, my mom used to say, he'll train you in a minute. As soon as he trains you, you're gonna be fine. But as long as you're trying to fight it, you will not be trained. I can honestly say I've been trained by both my kids. So, so I know what to do. But you're absolutely right. Thinking about all those pieces, like I found myself, like I actually had the postpartum anxiety. I ended up in and I was also trying to balance all the things. Like you are supposed to breastfeed here and you do that. And so I got all the things together in my head and I said, well, I don't need to sleep with the baby in the bed. So I went and got in his crib and tried to breastfeed in the crib with him. And I was like, this is ridiculous. Why am I here? I need to get out because this is
Yeah.
not working for anybody. But it was just the anxiety.
Yeah. Well, and y'all, I'm like, I know a lot of people who've tried to sleep in a crib. I know a lot. Because you get so scared.
Hmm
I was like, we will have another session on sleep. I think that's a very complicated topic of safe infant
And
sleep,
sleep. Hmm
how to manage all these pieces. Well, thank you both, Kimberly and Bernadette. Thank you so much. We do have 3 minutes, and I do want to make sure we end on time.
hmm
And thank you all for joining us. And we will be recording this, and we've been putting it up on our YouTube channel. And it's just been phenomenally received throughout the community. And thank you for those who are able to join us live. And thank you to Piedmont AHEC for all of your support in this series. This is our last one in this funding. So I'm going to say one more thank you to the county commissioners and the Durham County Department of Public Health for helping to fund this project. It's been a phenomenal experience. So
Thank you for having me.
Yes, thank you, everybody. This has been a great session with honest and helpful feedback from participants, Bernadette and Kimberly. Like I said earlier today, you all will be receiving an email tomorrow morning with instructions on how to complete your evaluation. And after you complete your evaluation, you'll be able to request your certificate of completion through your My AHEC accounts. If you have any questions about attendance, certificates, or evaluations, you can always reach out to me or Piedmont AHEC customer service. And I think that is all for tonight. So I hope you guys have a great rest of your evening and a lovely weekend.